Did you know that a good night's sleep is essential for your overall health and well-being? But what happens when you can't sleep, no matter how hard you try? That's where sleep disorders come in, and they're more common than you might think. Welcome to 5-Minute Health, your go-to source for all things health and wellness. Today, we're discussing an important topic that affects many of us: sleep disorders. In this video, we'll be exploring the different types of sleep disorders, their causes and symptoms, as well as prevention and treatment options to help you achieve a better night's rest. So whether you struggle with insomnia, sleep apnea, or any other type of sleep disorder, stay tuned to learn more. Let's get started. Sleep disorders are a group of conditions that affect the quality, timing, and duration of sleep. These disorders can have a significant impact on a person's physical and mental health, as well as their overall quality of life. In this video, we'll be discussing the causes, symptoms, and treatments for some of the most common sleep disorders, and providing tips on how to get a good night's sleep. So if you're tired of tossing and turning all night or struggling with excessive daytime sleepiness, stay tuned for some valuable information on sleep disorders. There are several types of sleep disorders that can affect a person's ability to get quality sleep. In this video, we'll discuss the most common types of sleep disorders and their symptoms in detail. Insomnia. Insomnia is the most common type of sleep disorder, and it refers to difficulty falling asleep or staying asleep. People with insomnia may also wake up too early or feel tired upon waking up. Common causes of insomnia include stress, anxiety, depression, and poor sleep habits. Sleep apnea. Sleep apnea is a disorder in which a person's breathing is repeatedly interrupted during sleep. This can lead to snoring, gasping, and choking during the night. Sleep apnea can be caused by obesity, smoking, alcohol consumption, and other factors. Restless leg syndrome. Restless leg syndrome is a disorder in which a person experiences an irresistible urge to move their legs, especially when they are at rest. This can interfere with sleep and lead to daytime fatigue. Restless leg syndrome can be caused by genetics, iron deficiency, and other factors. Narcolepsy. Narcolepsy is a disorder in which a person experiences excessive daytime sleepiness and sudden sleep attacks. This can be dangerous, especially when the person is driving or operating heavy machinery. Narcolepsy is caused by a lack of a chemical in the brain that regulates wakefulness. Parasomnia. Parasomnia refers to abnormal behaviors that occur during sleep, such as sleepwalking, sleep talking, or night terrors. These behaviors can be disruptive to sleep and can cause injury. Parasomnia can be caused by stress, sleep deprivation, and other factors. Understanding the different types of sleep disorders can help individuals identify their symptoms and seek appropriate treatment. It's important to prioritize good sleep habits and seek medical attention if sleep problems persist. Sleep disorders can be caused by a variety of factors, and identifying the underlying cause is important for effective treatment. Let's take a closer look at some of the common causes of sleep disorders. Medical conditions. Certain medical conditions can disrupt sleep. For example, conditions like sleep apnea, restless leg syndrome, and chronic pain can make it difficult to fall asleep and stay asleep. Similarly, conditions like asthma, allergies, and gastroesophageal reflux disease, GERD, can lead to disrupted sleep patterns. Mental health disorders. Mental health disorders such as depression, anxiety, and post-traumatic stress disorder, PTSD, can also cause sleep disturbances. People with depression often have trouble falling asleep or staying asleep, while those with anxiety may experience racing thoughts that keep them awake at night. PTSD can cause nightmares and other sleep disruptions. Lifestyle factors. Certain lifestyle factors can also contribute to sleep disorders. For example, consuming caffeine, alcohol, or nicotine close to bedtime can disrupt sleep. Similarly, irregular sleep schedules, lack of exercise, and exposure to bright screens before bedtime can all impact sleep quality. Environmental factors. Environmental factors such as noise, light, and temperature can also disrupt sleep. For example, loud traffic outside your bedroom window or a bright streetlight shining through your blinds can make it difficult to fall asleep. Similarly, a room that is too hot or too cold can make it hard to sleep comfortably. Medications. Some medications can also disrupt sleep. For example, Certain antidepressants and stimulants can interfere with sleep quality and make it difficult to fall asleep or stay asleep. These are just a few of the many factors that can contribute to sleep disorders. Identifying the underlying cause of your sleep disturbance is the first step towards effective treatment. Treatment options for sleep disorders can vary depending on the type of disorder and its severity. Here are some common treatment options. Cognitive behavioral therapy, CBT. CBT is a type of therapy that helps individuals identify and change negative thoughts and behaviors that may be contributing to their sleep disorder. It can be helpful in treating insomnia, as it can address issues such as anxiety and stress that may be preventing a person from sleeping well. Medications. There are several medications that can be used to treat sleep disorders. For example, benzodiazepines can help to reduce anxiety and promote relaxation, which can be helpful for treating insomnia. Other medications, such as antidepressants, can also be used to treat sleep disorders by regulating sleep cycles. Continuous positive airway pressure, CPAP. CPAP is a common treatment for sleep apnea. It involves wearing a mask that delivers a continuous flow of air into the airway, which can help to keep the airway open and prevent apneas, pauses in breathing. Oral appliances. Oral appliances can also be used to treat sleep apnea. These devices are designed to keep the airway open by repositioning the jaw and tongue. Surgery. In some cases, surgery may be necessary to treat sleep disorders. For example, surgery can be used to remove excess tissue in the throat that may be obstructing the airway in people with sleep apnea. It's important to note that treatment options can vary depending on the individual and the specific sleep disorder they are experiencing. It's always best to consult with a healthcare professional to determine the most appropriate treatment plan for your specific situation. Before I share some tips on managing sleep disorders, I'd like to request all of you to hit the subscribe button and turn on the notification bell to get notified about our upcoming health videos. Your support helps us to continue creating valuable content for your well-being. Now let's dive into some tips on managing sleep disorders. Now that we've covered the different types, causes, symptoms, and treatments of sleep disorders, it's time to discuss some tips that can help improve your sleep habits and overall quality of sleep. These tips can be applied to a variety of sleep disorders and can be a helpful addition to any treatment plan. Stick to a sleep schedule. One of the most important things you can do to improve your sleep is to establish a consistent sleep schedule. This means going to bed and waking up at the same time every day, even on weekends. This helps regulate your body's internal clock, making it easier to fall asleep and wake up naturally. Create a relaxing bedtime routine. Creating a relaxing bedtime routine can help signal to your body that it's time to wind down and prepare for sleep. This can include activities such as taking a warm bath or shower, practicing relaxation techniques like meditation or deep breathing, reading a book, or listening to calming music. Limit stimulants before bed. Avoid consuming stimulants such as caffeine, nicotine, and alcohol before bed. These can interfere with your ability to fall asleep and stay asleep. It's also a good idea to limit your use of electronic devices before bed, as the blue light emitted from screens can disrupt your body's natural sleep-wake cycle. Exercise regularly. Regular exercise can help improve the quality of your sleep, but it's important to time it right. Avoid exercising within a few hours of bedtime, as this can actually make it harder to fall asleep. Instead, try to get your exercise in earlier in the day. Create a comfortable sleep environment. Make sure your sleep environment is comfortable, cool, dark, and quiet. Invest in a comfortable mattress and pillows, and consider using blackout curtains or a white noise machine to help create a peaceful environment. Conclusion. These are just a few tips that can help improve your sleep habits and overall quality of sleep. It's important to remember that everyone's sleep needs are different, and what works for one person may not work for another. If you're struggling with a sleep disorder, it's always a good idea to talk to your healthcare provider about your symptoms and potential treatment options. Thank you for watching this video on sleep disorders. We hope that you found this information helpful in understanding the different types of sleep disorders, their symptoms, causes, and treatment options available. If you or someone you know is experiencing sleep disorders, it's important to seek professional help from a healthcare provider. Remember that there are many effective treatments available to improve the quality of your sleep and help you get the rest you need. If you enjoyed this video and found it helpful, please don't forget to subscribe to our channel for more informative videos on health and wellness. Thank you for watching, and we'll see you in the next one.